o'clock. Welcome to the Health and Human Services Committee meeting. First item on the agenda is the Pledge of Allegiance. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item number 3, need an adoption of the agenda. Can I have a motion, please?
So Romano to adopt.
Myjack supports.
Okay, I have Commissioner Romano, Commissioner Myjack, please vote.
That motion passes 10-0.
Thank you. Item number 4, public participation. Any members of the public wishing to speak, you have 5 minutes related to items on the agenda. If you would hit *6 to unmute yourself, you can just talk and tell me your name and I will let you have 5 minutes. So we're going to go with public participation. First call. Okay, second call for public participation. Again, hit *6 to unmute yourself. If for some reason you wanted to speak and you missed it the first one, there is a second public participation. And third and final call for public participation. Any members of the public on the line or on the computer wishing to speak? All right, we're going to close public participation. Item number 5, department recommendations. 5A, agreement by the Wayne State University Physicians Group, COVID-19 testing services. I'm not sure if who is Bill Rodella maybe on the line for this one. And can I get a motion to support and move this to full board?
Motion to approve, Duge.
Okay. Commissioner Hawley, I have a support on you.
Yes.
Thank you. I'm not sure who's here to speak on this. Bill, are you on the line?
Yes. Can you hear me, Bob?
Yep. There you are. Thank you.
Good. Good afternoon, Chair Smith and commissioners. As we continue to conduct community testing for COVID-19, whether it's at congregate locations, our nursing homes, long-term care facilities, adult foster care homes, recovery homes, homeless shelters, as well as at community sites. Wayne State Physicians Group is a organization that has been doing a number of mobile testing. We would like to partner with them through this contract to continue to support their work here in Macomb County as they're doing some in other counties. They've been doing work already here, but we want to establish this relationship and work closer with them. We think this is an important partnership for the continued need to do testing, whether it's at the municipal, community level, or within some of our congregate sites. And they have vehicles and a mobile platform that is very good. So we ask you to support this agreement. And this would be supported through CARES Act funding. And also into next year, if we were to get to do this into 2021, we would have some grant funding from MDHHS, the State Health Department.
Great. Thank you. I have Commissioner Duge on the line. We're ready to speak. Go ahead, Commissioner.
Thank you, Mr. Chair. Question, are there any plans to have testing done in the southern side of Warren at this point of time?
Commissioner, currently we have one of our federally qualified health centers on 10 Mile called MyCare. They are doing testing every day. We are in between Van Dyke and Mound and are available. But again, if we could partner here with a group like Wayne State, and if there's a particular community location where we see there's a need, then that's where we can deploy their mobile vehicle to do some of that.
Well,
they've done a little partnering with the city of Warren, but we want to continue these on a more frequent and routine basis.
Well, my concern has been in the southern section of the city, and it seems like we were not getting the availability of testing, and it's good to hear that testing is getting started. if I can make a suggestion that possibly doing it at the Thompson Center might be a very good idea to have testing there. But I'm glad to see this is moving along. Thank you, Mr. Chair.
Thank you, Commissioner Duge. I don't have anyone else lined up to speak. So we have a motion and support. Bill, thank you. Commissioners, please vote.
That motion passes 10-0.
Thank you. Thanks, Bill.
Thank you.
Item 5B, budget amendment, Macomb Community Action supportive services for veterans, families program. So I know Laura's on, I know Gary Cutler's on, I know Ernest is on. So I'm not sure exactly who's going to speak to this. So if any one of you would wish to speak to this, please chime in.
Bob,
Hi,
this is Gary Cutler. I'm happy to speak to it.
Hi, Gary. All right, what are we doing here?
Mr. Chair, do we need a motion first?
Oh, yes. Yeah, thank you, Commissioner. Well, I'm going to take that as a motion by Haw. Do I have support?
Carabelli.
Other
Okay,
support.
Commissioner Carabelli. Okay. Go ahead, Gary. Thank you.
So this is just a line item transfer. We're reallocating some funds with our SSVF, which is Specialized Services for Veteran Families. We're just doing a reallocation. We're moving money out of staffing and we're moving it down to provide more rent assistance to homeless veterans and their families.
Okay. Commissioners, I don't have anyone on this item to speak. So if you want to sign in, sign in. Otherwise, we have motion and support. Please vote.
That motion passes 10-0.
Thank you. Item number 5C, COVID budget amendment, Macomb Community Action, senior services, Meals on Wheels, conversion packages. Can I get a motion for that?
So moved, Duge.
Okay.
Support Romano.
Okay, I have motion and support. Gary, is this going to be you again?
I'm happy to speak on it. Steve can speak on it, or Larry, Lee, or Ernest. But basically,
I'm more than happy to.
Okay, well, Steve, since you're there, we haven't heard from you yet.
Obviously this is related to the next item on the agenda, which is the purchase of 5 trucks for the Meals on Wheels program. And what we're simply doing here is moving money from appropriations or supplies and services into capital outlay to fund the purchase of the vehicles. So what we did, generally speaking, you'll see maybe a few of these coming through in the next month or two as we move through the COVID crisis. When we allocated the money from the CARES program or CARES Act, a lot of that money was generally put into appropriations or supplies and services. And as we're moving through the process, we're finding that we need to buy equipment here or there. So this is simply a budget neutral reallocation.
Okay. Steve, I have a question. I don't have anyone on yet. At least I don't see anyone. So we're buying new trucks. Are these additional trucks or are we replacing some trucks? I'm sorry. I should be up a little more.
I'll defer to Gary on that.
Okay.
Okay. So we are purchasing additional trucks. What we currently are doing is we're borrowing other trucks and we're around the county and outside the county in order to provide the services. But these units, the back end of these units is a hot heater area and a cooling area to keep our hot food hot and our cold food cold before we deliver it to our seniors. But as you're probably aware, with the COVID, normally Meals on Wheels is done through a volunteer group.
Yes.
And we're not using volunteers. We're using reallocated county staff generally to provide these services. And we're also using reallocated county resources. But we need these additional vehicles in order to continue to provide the services as other departments are going back to work and you needing their vehicles for normal work.
Sure. Great. Always happy to support Meals on Wheels. I don't have anybody on the line to speak on this, so we have a motion and support. Please vote.
That motion passes 10-0.
Great, thank you. And then 5D, which is actually the purchase. Can I get a motion for that?
Motion by Romano.
So moved. Second by Hall.
I have Romano and a whole bunch of others. So Mike,
Pick your
one.
choice.
All right. I don't think that there's any, I'll just check, but I don't think there's any need to speak on this. It's the same item basically. So everybody, please vote.
That motion passes 11-0.
Thank you. Thanks, Steve and Gary, for that update on those. Item number 6, presentations. We have Laura Rios for the Veterans Second Quarterly Report. Can I get a motion to receive and file?
Motion by Hall.
Support Garabelli.
Support.
Great. I have motion and support. Laura, are you there?
Can you hear me?
I can. Thank you for coming.
Okay. Because I have problems with my laptop. Sorry. So our quarterly report for most of March, well, half of March, all of April, May, we returned back to work in June. So all of April, we were home, working from home. So if you see the burials, they went down significantly. Actually, not really, but for the second quarter. But because we're not really doing a lot of our burial benefits right now. We're continuing to do claims, but not burials. And then the tax program was extended till tomorrow, and that wraps up tomorrow. So other than that, I want to say in April, sometime in April, we went standalone retrospect. So now I'm not getting notifications when people actually get their award. It's up to the veteran then to call us or for us to check. So our number 11 and 12 is going to probably start to decline a little bit because of not getting those automatic notifications. So, but we're still doing good on those numbers right now, but it's going to start to decline. But we'll deal with it when we deal with it. So it's us tracking our own data versus us receiving the data.
Okay. All right, let's mute somebody who needs to be muted first, and then we'll go with Laura. You also have on the correspondence, you have the veterans, what every veteran should know
Yes.
flyer. Anything you want to tell? I mean, that just normally is a receive and file. Anything
Yeah.
you want to tell us about that?
I don't have that in front of me.
Oh,
So,
that's,
I usually read it and I file it in the back of my brain, and then it comes every month or it comes every quarter, and
right.
and then I
No
process
worries.
it. Yeah, the VA is taking appointments now. They are slowly doing in-person appointments. I do know that. So that's a big change from 3 months ago.
All right. How many veterans took advantage of the free tax service this year?
I don't have those figures because we're still doing taxes until tomorrow. I have not pulled any reports. I will share all my data as soon as I download it, and that probably will be Thursday or maybe Monday. But depending on how many, the state takes up to 2 days to process before I get an accept. So I don't want to do too many reports before I see all the accepts from the state. But I am looking at least we're doing the same amount of numbers from last year. We might, amazingly, because we were shut down for so many months.
Sure.
But I think we're going to at least meet what we did last year, maybe just a few more. Not many. We were on target to do about 1,700, and we did 1,500 last year.
Wow.
Right now, we're probably just over 1,500.
Okay, great. Good to hear. All right, I don't have anybody on the line to speak. So I know we have a motion to receive and file, so let's vote, commissioners.
That motion passes 11-0.
Thank you, Laura. Item number 6B, Martha T. Berry monthly report. I know Kevin Evans is with us. Commissioners, can I get a motion to receive and file?
Support Carabelli.
I had a motion by Carabelli. Who did I have support by?
Haw.
Okay, Harold, Commissioner Haw. Kevin Evans, welcome.
Thank you, Mr. Chair. Thank you, commissioners. As you know, our facility has been working diligently to try and combat COVID-19 in community and outside. One of our biggest challenges, of course, is the staff trying to re-enter their own lives and still keep us safe. So we are doing weekly testing. We actually started doing testing of all employees prior to the mandate by HHS, and we had found a number of asymptomatic staff members back then. We started again this month, and we found 4 more asymptomatic staff members that were tested positive. Because of that, the new requirement is we test all residents as well, and we found 4 residents that were asymptomatic that still are tracking with the virus. We still have 1 person that is in her 70th day with the COVID-19 positive, asymptomatic. That means since the beginning of May, she has been continuing to test, no symptoms, and remains in isolation. The World Health Organization has discussed, actually as late as the 8th of July, the thought that it is highly unlikely that the asymptomatic people that have tested positive are highly unlikely to be carriers and to transmit an infection. However, there is no direction from CDC, and the CDC is the organization by whom we follow our guidelines, as well as CMS and CDC. We also follow the governor's mandates, and the governor says right now we're testing weekly based on the Michigan Department of Health and Human Services direction. And we test staff as well as residents weekly if there's any positive. That is particularly distressing to our team and to our residents who don't like having something stuck in their nose weekly. On better news, we have been, because we've had a lot of additional cost, we have been working with finance on CARES Act money, and we received our first check from the county for the CARES Act money that was approved by the commissioners to go towards us. So that has helped keep our cash stable. Thank you very much for that. We are looking to have more expense to that throughout the rest of the year, but we have no expectation that it will exceed the $3 million that was allocated out of the 150 for Martha T. Berry. Although, just so you're aware, the employee testing does cost about $30,000 a week. More good news, Mia Moore is a CNA that has been with us for 13 years, and she was appointed to the governor's task force to create a framework for what happens the next time, how to prevent, predict, prevent, and fight against any potential new virus coming in. She's one of a number of people. Many of them are at the state level of distinguished attorneys and representatives from trade associations and consultants. So I'm hoping that Mia's voice will be heard well there. She's an outstanding nurse aide, and I'm glad that she's on there. You all may have received a copy of the Free Press article that came out today and will be printed, or scheduled to be printed tomorrow. We had our first visitations inside our facility. This is not opening up the nursing homes as some people characterize it. Rather, the governor still has a restriction on visitation with the exception of certain criteria. And that criteria is defined by Director Gordon from the Health and Human Services. He set forth 34 criteria in a 4-page document by which we have to comply in order to begin visitation. The good news is most of that is common sense, and we were already practicing some of it. There are a few extra challenges that we have in that the window visits and these visits require dedicated personnel. So we need extra people to be able to pull from their current jobs to do this. And when we have somebody, well, for example, the reason that I was in the photos yesterday was because the person that was scheduled called in sick. So I had to pick up doing the infection prevention and the family liaison work, which I was pleased to do. With that, I have no more.
Well, with that, let me just double check and make sure I didn't mute myself. Kevin, I don't have anybody on the line to speak. So commissioners, click in quick if you'd like to speak. I don't have anybody. Thank you, Kevin, for that report. I'm glad to hear things are going well. Glad to hear, for the residents' sake, that some in-person visits are taking place. I know that's very important. So I don't have anybody on the line to speak. We have a motion, so please vote. Hey, Kev, while you're there, are they getting adequate personal protective equipment there? Are we caught up on that? Or we have some supplies in case things go south again?
Great question. Thank you. Yes, we right now are stocking up with a 3-month supply is what we're looking to have. There are some items we only have probably 3 weeks in. So we're hoping that if we have a supply chain glitch again, like we had at the beginning, we'll be able to weather it until the supply chain reemerges. We've been working with the Emergency Operations Center. They've been great working with us, getting us resources. We've been actually sharing some resources, and that's been quite helpful. We've also had some great donations from Ford and General Motors on face shields, and some family members that own companies donated some hand sanitizer. So yeah, we're in great shape right now for it. Thank you.
Good, thank you. Mike?
That motion passes 11-0.
Thank you, Kevin.
Thank you, Mr. Chair.
Thank you. Item number 7, correspondence. We have 7A, the governor's press release about making appointments to the nursing home, which Kevin just talked about, and the Veterans Affair, What You Should Know newsletter. We would like to take those combined.
Move A and B.
Okay, Commissioner Drollet.
Receive and file.
Yeah.
Romano. Support.
Commissioner Romano. All right. Everybody, please vote.
That motion passes 11-0.
Thank you. Any commissioners with new business? Any commissioners with new business, please speak up.
Commissioner,
go ahead.
Chair Smith, Commissioner Romano. Yes. On behalf of all the commissioners with no objections, I am paying tribute to a resident of Sterling Heights on her 100th birthday. And again, with no objections from the commissioner, I will have that tribute signed and given to her on behalf of all of the commissioners. Thank you, Chair.
Fantastic. All right. Any other commissioners with any new business? I'll treat it like public participation. Last call for new business.
Yeah, I should be on the list, Veronica.
Nope, but go ahead.
Okay.
Oh, now you are. There you go.
Two things. I have a NACO board meeting tomorrow from 3 to 6.
Okay.
So I won't be in attendance at our meeting. Also, at the NACO business meeting next week, they in order for me to vote on the business at hand, I need to be the voting delegate from Macomb County. they asked that each county select a delegate, so I'm requesting that at the full board meeting, if we could place it on the agenda to vote, to have me be the voting delegate at that meeting, I would appreciate that. And I don't know if Steve Smiegel's still on, but I want to make sure that we are up to date on our NACO bill, or I will not be able to vote at that meeting. Thank you.
Yeah, I'm still on, Commissioner. I'll make sure it's paid. I don't know if it is or isn't, but I will ensure that it is.
Thank you. Thank you, Steve. Commissioner Myjack.
Thank you, Chair. Yeah, so just so everybody knows, we have a public services meeting tomorrow for 3 o'clock. There are a couple items on the agenda. Some are road projects with Brian Santo, and then there's some budget amendment and contractual service agreements with some of our local chambers and Vicky Rad from the county. And basically that pertains to $70 million out of the CARE Act that's going to be spent on businesses in Macomb County. So I was talking with some of the chamber people today about that. Just wanted to make all of you aware. You could think about that. Any questions you might want to ask for that. And again, that's for tomorrow's agenda items. Thank you.
Thank you. Any other commissioners? If not, I'd like to, say that's nice that Joe, Commissioner Romano, could give his classmate this proclamation or this recognition for their 100th birthday. We'll get out of new business before he gets back on and go to public participation. Any members of the public wishing to speak, you have 5 minutes to speak on any topic. Press *6 to unmute and let me hear your name and address, and you'd have 5 minutes. So any member of the public wishing to speak? Going twice. Any member of the public wishing to speak? Third and final time. Any member of the public, press *6 or join us tomorrow if you can't figure it out.
Motion to adjourn.
I have a motion and support. Please vote.
That motion passes 11-0.
Commissioners, meeting is adjourned. Thank you. We'll talk to you tomorrow.